A 55-year-old male having bone pains for the last 2 years present with the image as shown below, most likely diagnosis. So what do you see? It's a skull with a classical raindrop appearance, or what you call as a punched out lytic lesion. That's an extremely important type of question that we get in the exam, which is the shape of skull. So this is a punched out lytic lesion, a raindrop appearance, which is a feature of multiple myeloma. Now, this is not hyperparathyroidism. In a hyperparathyroidism, you will see small black and white dots which look like a salt and pepper pattern. So you should learn to differentiate salt and pepper from raindrop appearance. After radical resection of chordoma, it should be best treated with which form of radiotherapy? So please remember, it is ideally treated with proton, because chordoma, as you know, is commonly involving the clivus or sacrum. Now, the problem that happens is the surrounding structures are radiosensitive. So you want a kind of radioactive source that is directly targeting the tumor tissue without damaging the surrounding area, and that is done by proton because of its Bragg's peak phenomena. Because of this Bragg's peak phenomena, the proton is directly damaging the tumor tissue. A 45-year-old female presented with chest pain and breathlessness is the casualty, and below is the representative CT section. Look at the dye in the pulmonary artery, and you are seeing a filling defect in the pulmonary artery going into both the branches, a typical example of pulmonary embolism. Look at the image. You are seeing a T1 sagittal image. You are seeing a suprasellar enhancing mass. 6-year-old boy complaining of ignoring to see the object on the side of the examination. Why? Because of the compression of the optic chiasma. He is having visual field defects. His IQ is normal. Visual acuity is diminished. The radiological image is there. What is the most likely diagnosis? So you have an enhancing suprasellar mass in a boy, in a young child. The answer that should come to your mind is a craniopharyngioma, which is usually a cystic lesion, but a solid cystic lesion is usually the norm. So a craniopharyngioma in a suprasellar location is the classical answer. What is the most appropriate investigation to be done to confirm a malignant carcinoma of pancreas? In order to confirm it, you need to localize it, and the most useful imaging investigation to localize it is EUS, endoscopic ultrasound, and hence the best answer is endoscopic ultrasound guided FNAC.